ALK lung cancer, as you know, is uncommon, and we don't have a lot of large randomized studies and head-to-head comparisons with all of the available agents. But what we do have are comparisons against crizotinib, which can serve as a reference against which all the other drugs can be compared. Matched adjusted indirect comparisons are a way of formally doing cross-trial comparisons when the reference arm is the same in both trials. So we have in the CROWN data, we have in the alectinib clinical trials and in the brigatinib clinical trials, randomization against crizotinib. So we can make adjustments according to the patient demographics, gender balance, race balance, and other prognostic indicators to then adjust the population so that they have similar compositions and then determine whether or not the drugs are really better than the other with regard to crizotinib. So these matched adjusted indirect comparisons allow us to show that lorlatinib does seem to have superior efficacy from the standpoint of progression-free survival against both alectinib and brigatinib, and it also has increased toxicity. And so decisions as to which drug to choose need to balance those features. We found that all the drugs are better than crizotinib, but lorlatinib in particular seems to be more better than the other drugs when compared to crizotinib. And so it does seem to have the best difference in terms of hazard ratio for progression-free survival. It does also have increased toxicity, and the toxicity that I think is most concerning for lorlatinib is neurocognitive toxicity, which can really be a problem for patients in terms of their mood, personality, and quality of life. And I think most of the discussion that we had at the meeting today was how those factors should be balanced. Many of the clinicians in the room thought that the best approach was to use lorlatinib because it's the most powerful drug, but use it as a reduced dose. Others felt that it needs to be an individualized decision that the patient makes after a discussion of risks and benefits.